Hello, everyone. Thank you for joining me today. My name is Amie Duff, currently a nursing student at Indiana State University. My presentation today on opioid abuse in the community of the United States is brought to you as a part of my community health nursing class. I've provided you with links below the video for a pre-test that I would like you to take prior to viewing this information, so you can kind of see what you already know about the topic, as well as a post-test to help you reflect on what you might have taken away from today's presentation. There's also a link to a flyer that's some quick information on the topic, as well as further resources if you're interested in doing more research. Let's go ahead and get started today by taking a look at my objectives for your learning. 1 and 2, I want to provide you with an understanding, with education, with insight on the topic. I want to give you an education so that you understand and know what's happening with this crisis in the United States. Objective 3, raising awareness. This is a problem. It's a scary problem. It impacts people's lives across all demographics and ages, and this is something that we all need to be aware of. And then finally, objective number 4 is to understand prevention, and it might give you then an idea of what's being done to counteract the problem, along with maybe give you some ideas as to what you can do as a member of the community, a member of the healthcare community. Wherever you stand, you might get an idea then what you can do to impact the problem. Let's take a look at some quick facts. 50,000 dead in 2019 from opioid use and abuse. Staggering numbers. Looking at this, emergency department visits between the years of 2005 and 2014 increased by a staggering 99.4%. Looking at this top slide here, those are preventable emergency department visits and deaths. The drugs that I'm talking about and the substances I'm talking about include prescription narcotics as well as the illegal substance heroin. The economic impact in the United States for all-encompassing treatment, prevention, lack of production because of opioid abuse use. The cost of everything is over $78 billion yearly. This is a huge number. These are all numbers that we want to reduce. This problem started in the 1990s. Pharmaceutical companies assured prescribers this substances weren't addictive. There's kind of a lack of understanding or communication, and come to find out they are highly addictive, and it started kind of that rise in this problem. It has devastating consequence. These are avoidable deaths. The crisis is avoidable, but it's devastating. It leads to these overdose deaths and preventable. Impacts people's lives. And 21 to 29% of people that are prescribed narcotics misuse them. We can help reduce numbers by all working together as a community, as healthcare providers, members of the community. Get these numbers down. Next, let's talk about what are opioids. So what I'm talking about are prescription medications used to treat pain, and they're very effective, and if they're used properly, they work well. There's no reason to not use them. These are some of the most familiar names that you might see, fentanyl, oxycodone, Vicodin, Norco. And most people that use these, I don't want to scare anyone away, don't become addicted. Heroin is an illegal opioid substance that a lot of people turn to after getting addicted to the prescription form of opioid, and this is a cheaper alternative, although it's so addictive, so scary. Opioids act on receptors in the brain, opioid receptors in the brain and other areas of the body and the spinal cord. And what they're doing is they're reducing the pain signal and intensity, perception of pain, but they also act on those reward centers, causing a kind of a euphoria or high, and that's what people are looking for when they're using these medications. Fentanyl, note this, fentanyl is the strongest of these, and it's 80 to 100 times stronger than prescription morphine. This is a scary drug. It's considered a synthetic opioid. Moving right along here, let's take a look at when the problem started. Again, I will mention this started in the 1990s when prescribing of these medications, that the full impact and addictive quality of these medications wasn't fully realized. The second wave came in 2010 with increases heroin overdoses, when people, I'll mention again, people switch from using the expensive prescription form, harder to get a hold of, and went to this heroin and subsequently overdosed. The third wave came in deaths related to synthetic overdoses. When I mentioned fentanyl is a synthetic opioid, people overdose. It's hard to regulate the amounts it's getting put into other drugs and other substances, and it's a scary, scary thing, and can, cause people to just stop breathing. Next, we're going to look at other parts of the problem here. And so this, risk for tolerance to the medication, physical dependence, and side effects. So tolerance, is the need for increased amount of medication to achieve the same level of pain relief. So if you're prescribed 5 milligrams every 4 hours and you have to bump it up to 10 milligrams every 4 hours to feel that same effect, and then to 15 every 4 hours to feel that same effect, or you're using just more and more to achieve that same level of high or euphoria, or treat that pain, that is tolerance. Physical dependence is when you cease to use the medication and you notice withdrawal symptoms, uncomfortable withdrawal symptoms. People feel sick and not well. Once you restart the medication, those go away. So that may indicate physical dependence. Some of the side effects of opioids: constipation, itching, nausea, vomiting, confusion, drowsiness. These are all things experienced as side effects to the medication. Let's take a look at risk factors. Not all of these, if you have one or two or three of them, indicate that you will be an opioid addict. Rather, these are things that just, when looking at the topic, are increase somebody's risk for the potential. Current or past substance abuse, young age, psychological trauma, disease, mental illness, stress, embellishment of pain, smoking, inadequate social support. These, are all things that are identified as potential risk factors for use and abuse of the medication. So, I want to talk about prevention. That's the most important part of this. So improving prescribing, reducing exposure is something that physicians can do to help reduce the incidence, reduce the numbers, and impact this problem. That is finding alternative treatments for pain. People have chronic pain. Let's get creative and think about things we can do to improve people's pain and need for these medications. They are great medications when used properly as prescribed and for their time limits on them. It definitely is something that is a good thing, but there's other ways that we can treat pain without the use of these. Treat the disorder. Somebody has a misuse disorder, they need help with that. Let's get them help and get them back on the right track. Prevention. Before a problem even starts, monitoring programs, laws, things that pharmacists can do, pharmacies can do, law enforcement can do to help prevent the problem from even happening. And then naloxone is a medication I wanted to mention that is getting more prevalent, and people are gaining more access and training as to how to use it. There's standing orders available for entities in order to get a hold of this medication that rapidly reduces the effects of opioid overdose, and this saves lives. So finally, here are some resources I provided for you. More information on the topic, feel free to click the links and or copy the link. Let's take a look. These are the references that I've used in my presentation.